Yeah. So I think healthcare data is definitely far more messy than any other domain I've ever worked with. Um, the way I think about it is there are certain things you can do with it, and there are other things you can't do with it. Which is why it's even more important to have deep expertise in understanding the data, the complexity of the data, but also the problems you're looking to solve with it to understand the risk profile, right? Just like in a drug, there's a notion of risk benefit analysis, right? Almost everything comes with like a some kind of side effect. So how is it getting used on whom? What's the side effect? What's the benefit? And there's a risk benefit trade-off. So in the same vein, in terms of health data sets, there are some applications where today's technology is just not there. There are other applications where today's technology isn't there, but you could build the right technology to improve it. And there are yet other applications where no amount of amazing technology can help you because the information doesn't exist.
Mhm.
So I think there's certainly a number of problems where the information doesn't exist and we just need new modalities. But the vast majority of problems are the kinds of problems where the data exists because today human experts like physicians, nurses, care team members are looking at this data and making decisions, right? So the data exists and there's an opportunity to leverage the data in a much more intelligent way to be able to so it's all to be able to improve the quality of decision makings and outcomes, right? So it's like a human expert is looking at it
Yeah.
and they're making decisions, so whether you like it or not, it's happening. And so now the question is, how amenable are these? And I think that's where we need the right kind of machine learning AI technologies that are, humble, where like the researchers building these tools are humble, they understand the difficulty of it, and they're intelligently approaching, you know, which problems to tackle, and then doing very careful evaluation. So I guess another theme here is evaluation. So because this area is hard and correctness is so crucial, I almost feel like, unlike other fields where people spend 10 units of time, like 90% of the time developing a model, and then 10 minutes writing it up. Here it's the
Mhm.
flip. It's like whatever time you might spend the model, you need to spend 9x that much more time triangulating in many, many ways to get to a place where you know it works.
Yeah.
And that makes this really hard. So yeah, so I think it's very promising. I think the data are exciting. I think there are loads of opportunities. It's just it requires more patience, more thoughtfulness, more carefulness.